The worst part of natural medicine. What's going on, Secoya Nation? Dr. Schilling bringing you today's wellness wisdom, and we're going to dive into a story here to help you understand what the worst part of natural medicine is. So here's an example. We have a participant we're working with who's had, and this is just one example, and this is how we approach things, so bear with. They've had thyroid issues, and they've had the fatigue, and they've had the puffy eyes, and they've had the stress, and they had the constipation, and the cold hands and feet, and the hair loss, and all the other stuff. And they've been everywhere. They've tried their Beamer mats, they've tried Reiki, they've tried everything. You got somebody coming in?
No.
Okay, Christina's waving at somebody. They've tried supplements and medications. They've said their Synthroid or levothyroxine or whatever it is. And so how would we approach that differently? Because the worst part of natural medicine is people give you a pill for a symptom. All right? You go to the doctor, you have the symptom, they give you a pill for your symptom. So what does that mean? Most people have tried 8 to 12 things before they ever get to us because they think those are meant to fix anything, but if they ever take a stop and look, those things were never meant to fix anything. So if this sounds like you or somebody like you, or if it doesn't have to be thyroid, it can be constipation, it can be skin issues, it can be brain fog, it can be joint pain, whatever it is. Let us help you show you the difference of what natural healing can be, because I'm going to explain to you the big difference between the big flaw with natural medicine, functional medicine, and how it's similar to allopathy. So allopathy is like traditional medicine. So what does that look like? You go to a doctor of medicine, a MD, and they give you a pill for your symptom. You have this symptom, they said, well, here, take this. But then you have a side effect of that pill, so you get another pill for that. And you get another side effect, and so on and so forth. Average person in their mid-years, like 40 to 50, they're on 6, 7? 12. At 50? Medicare patients, that's where I was going. Like they're on 12 different medications. Like 50 to 60s are on at least 4. Statistically speaking, once you're at 4 medications, you're at 100% guaranteed, do not pass go, do not collect $200, go straight to jail. Negative adverse reaction between 4 medications, and that's almost everybody in the 50 to 60, 40 to 50 range. So if you go to a functional medicine doctor, it could be a chiropractor, it could be a naturopath, it could be an osteopath, someone who has functional medicine training. They're basically doing the same thing. They're giving you a pill, a supplement for a symptom. Now, what's the difference? Pharmaceutical drugs were at one time herbs. And they took those herbs and they said, well, forget that, we're going to make them out of a chemical so we can make it more powerful. So that's how pharmaceuticals became in existence. So functional medicine doctors, they say, oh, take this herb or take this supplement, take this nutritional to help with your symptom, but they're not getting to the root cause. So that leads us to, like, what are you doing if you're going to a medical doctor versus a functional medicine practitioner that does the same thing, a pill for symptom paradigm? It's like the definition of insanity. You're doing the same thing over and over, and you're not getting any different results, right? You might feel better on the herbs than the pharmaceuticals, but it's not getting you anywhere. So very few practitioners do what we do, which is test for the root cause. Okay, so someone might come in here, and they might have all the symptoms of Lyme, but they have a fungal overgrowth in their gut that doesn't allow them to overcome any immune stress to actually rebalance the microorganisms. Okay. You need mold and fungus in your body. You need bacteria, parasites, and viruses in your body to help you heal. They're not like these opportunistic organisms that are killing you and trying to take, like, why would they kill the host? You're the host, okay? So we get to the root cause. And so when you think of us and how we're different, we're not just going to give you symptom relief by using supplementation. We're going to give you a checkup from the neck up. So what does that mean? That's why I use QNRT. So think of it as brain resets. You're changing how you respond to your stresses in your environment, how you react to your world, so that you become a different person. Because your personal reality, your life, is determined by your personality. Your personality is determined by the way you think, act, and feel, and that turns into your personal reality. Okay? So if you want a different personal reality, you want something different in life, you have to change the way you think, act, and feel. That's hard to do when 95 to 98% of your thoughts every day are the same as yesterday. So that's why we use brain resets and brain training, brain neurofeedback, to get you different, to help you be different, to think different, act different, and feel different. And so understanding that, the person who was dealing with the thyroid issue, we had to help her use her voice, right? Neuroemotional contact between the brain and the body is the voice, the power center. Speaking to reality, your truth, your power, standing in your power, saying, this is what I want, I'm not willing to settle for less. That's thyroid, just as an example. There's 100 million other different things we could talk about. And so if you are interested, this is your opportunity to request a consultation to see if we're the right fit for you, because we're not going to give you a pill for your symptom. We will help you feel better faster by using one of the 1,000 things on the shelf, but we're not going to use it forever. Like, whether it's levothyroxine, Synthroid, whether it's an Armor, Nature-Throid or some type of pill for your thyroid or whatever condition you have. We're not going to do that. That's temporary. If you don't change who you are, you're going to take that the rest of your life, because if you've ever taken a supplement or a pill, you stop taking it, you go right back to where you were. Nothing changes forever. You might feel a little bit better, but it's nothing residual. So your opportunity is to connect with us and find out how we can serve you at the highest level, because we're more interested in your health than you are, because you've lost your way. You don't even know how to fix it anymore. You got to trust in someone other than yourself at this point to say, how can they help me help myself? How can they empower me to speak my truth, stand in my power, live my best life, educate you on how to, do what you need to do to live the life you want to live. That's our job. That's what we do. We're dedicated to it. We're obsessed with it, if you haven't noticed already. So we invite you to come in, talk to us, talk to one of our team members. Our care coordinators are second to none, and they will treat you like the person you're meant to be treated, like a family member. Okay? So take it to heart. Let us know how we can help you. Comment below if there's something you're dealing with as far as your pill for symptoms scenario, your journey through medicine or natural medicine, and what you think is the worst thing about natural medicine or medicine in general. And we look forward to reading your comments. All right, guys? Have a great night. Bye-bye.